Good afternoon, and thank you for joining us. I'm Raisa Rodriguez, Executive Director of Citizens Committee for Children of New York. CCC works to ensure every child is healthy, housed, educated, and safe. And we rely on research advocacy and civic engagement to advance well-being, justice, and equity for all children in New York. CCC has a long history deeply rooted in rigorous data analysis and fact-finding to spotlight the conditions that children and their families endure, often due to systemic inequities. The need and urgency for evidence-based and data-driven advocacy has never been greater. Over the past 4 months, we have faced significant threats to funding, programs, and policies that are integral to child and family well-being. At the same time, we are witnessing a steady erosion of government accountability and the dissolution of public systems that are intended to support children and families most at risk. Now more than ever, it's crucial for New Yorkers like you to rely on data to elevate children's needs and advance policies that truly protect them. That is precisely our aim during this convening, to arm all of you with critical data that can inform systemic change. Over the past decade, CCC has released a Child and Family Wellbeing Index that has provided the necessary data tools for effective decision-making across policymakers and informed strategic direction across the philanthropic and nonprofit sectors. Biennially, we conduct this analysis at the city and state level to assess child and family well-being at the county or community level. Today, we will learn about our latest report, our third statewide index, which reinforces what we already know, that far too many families across New York State are contending with economic and housing insecurity, barriers to early care and education, and limited community resources necessary for children to thrive. This year, that stark picture has been underscored as critical programs for children and families are facing growing threats across all levels of government. Our hope is that this data will serve as an entry point for critically necessary and ongoing dialogue on children's and families' needs and the budgetary and policy solutions that can address such needs. The importance for data-driven advocacy cannot be overstated, as both city and state are in the throes of budget negotiations. CCC has leaned on the state index data to advance budget priorities that illustrate the importance of investing in economic security, stable and affordable housing, behavioral and developmental supports and services, affordable and quality childcare, and community resources that reduce involvement in child welfare and youth justice systems. Thank you for joining us today and for recognizing the important role that data plays in influencing positive change for children. A special thank you to the CCC team, who has worked incredibly hard at analyzing the data, aligning the findings with our advocacy and civic engagement activities, and creating this learning space for a data-driven discussion focused on solutions. Now I'll turn it to Rimsha Khan, CCC's Senior Research Specialist, who led the analysis and authored the report. Thank you once again.
Thank you so much, Raisa. Good afternoon, everyone. Thank you for joining us, especially on a Friday afternoon. My name is Rimsha. I'm a senior research specialist, and I lead the production of several of our key data resources, including the state index, which we'll be talking about today. And as Raisa stated earlier, CCC's state index is not just a report showing statistics. It also reinforces the urgency of addressing issues of child poverty, homelessness, housing instability, food insecurity, and the basic services that families need. And across New York State and city, so many families are contending with economic and housing insecurity, challenges with early care for their children, and community well-being. And of course, the growing economic uncertainty, along with funding cuts at the national level, threaten to worsen these challenges. As you may know, the city administration released its executive budget recently, while the state budget was passed earlier this week. Given the emerging issues at every level of government and their close intersection with the findings of our Child and Family Wellbeing Index, we also want to use this presentation as an opportunity to update you on key policy issues at the federal, state, and local levels. When it comes to funding, there can often be a cascading effect from the federal level to the local level, and my colleagues and fellow presenters on the policy and advocacy team will walk us through that. So in terms of format, we'll switch back and forth between data and policy, following the theme of CCC's mission of healthy, housed, educated, and safe. And to begin, our state index looks at New York's 62 counties, measuring child and family well-being using administrative data across 6 main topic areas or domains. And that includes economic security, which relates to incomes, poverty, affordability in general, housing security, health, education, youth, and community well-being. So for each of these domains, I calculated an index score for each county. And I also calculated an overall index score for each of the counties. And I do want to note that there are many ways to measure well-being. Here we are using a specific administrative data set, and we're maintaining continuity with reports we've published in the past. That's not to say that well-being can't be observed from different dimensions, like resources that are available in communities, for instance, for education, libraries or museums, or resources outside of the system, like the benefits of having multi-generational childcare or grandparents taking care of children. So with that being said, I'll turn back to the state analysis. So to describe how counties compare, I sorted these counties into 3 categories. One was the greatest number of barriers or above average barriers to well-being, near average barriers, and finally, counties with few or below average barriers to well-being. And this term barriers here reflects the cumulative level of challenges or supports children and families face in different regions. More details, such as specific index scores, and to see where each county ranks or compares to others, can be found in the report itself. We have the detailed data available. Now, jumping right into the data by topics, as part of health well-being in the index report, we looked at healthcare coverage, specifically the rate of insured children compared to uninsured. And we can see in the light purple that the majority of children in New York City and at the state level are covered by health insurance. However, you'll see that the uninsured rate is slightly different, and New York has a 3% uninsured rate for children compared to the national rate of 5%. However, these averages can mask the inequalities or inequities when it comes to the data. When we look at the information at the county level, one of the main findings of the index was that in 14 of the counties, more than 5% of children lack health insurance. So that's more than the national rate. And the counties that had the highest uninsured rates were Yates County, 32%, followed by Seneca, with 14% of children without healthcare coverage. And delving a little deeper into this topic, let's look at Medicaid, which isn't actually covered in the index report, but is relevant to the policy conversation we'll be having. This chart shows the share or percentage of children who have healthcare through the Medicaid program, which is for people with low or no incomes. And these stats also include CHIP, the Children's Health Insurance Program as well, which is also income eligible coverage. We can see in the past few years that Medicaid coverage has increased both in the city and the state. And currently, 44% of the children in the state are covered by Medicaid, representing over 1.8 million children statewide. And in New York City, 55% of children representing nearly 940,000 children at the city level. So aside from the funding threats, which Alice will cover in the policy section, there is a policy change for Medicaid re-enrollment that I thought would be good to mention. The Medicaid program is no longer doing automatic renewals, and that will definitely be a barrier for re-enrollment. Studies show that this change alone, specifically the taking out the automatic re-enrollment, that will reduce Medicaid coverage by 10%. So something to keep in mind as we think about healthcare. And lastly, another point I wanted to include here that's relevant to policy priorities is SNAP, which is a federal program that provides food purchasing assistance for families and individuals with lower or no incomes. This chart is showing the number of households, specifically with children, that are receiving SNAP benefits. In the city, the number of households is over 271,000, and in New York State, in total, over 468,000 households with children were receiving SNAP benefits in 2023. This is 2023 data that's most recently available, and the complete data for 2024, I believe, at least on the city level, should be out soon. However, there are policy threats on the horizon when it comes to these programs, and for that, I'll turn it over to Alice, who will speak about policy.
Thank you, Rimsha. Hello, everyone. My name is Alice Buffkin. I'm the Associate Executive Director of Policy at Citizens Committee for Children. So good to have you guys here. Throughout this presentation, we are going to balance the data that Rimsha and Shabani are presenting with some of the key policy issues at the city, state, and federal level that directly impact the well-being of New York children and families. As you may know, the city executive budget was just released yesterday, and the state budget is entering the very final stages of negotiations after multiple extenders. There are countless issues we could discuss today impacting the health of children and families. However, given the analysis of health coverage included in the index, I'm going to focus my time on one of the biggest threats facing the health and health coverage in New York, and that is the cuts to Medicaid and SNAP that are currently being proposed by members of Congress. There's clearly much work our state still needs to do to address not only the remaining gaps in Medicaid and CHIP coverage, as Rimsha addressed, but also access to and quality of health services, which are distinct from coverage. However, the significant work that New York has done expanding care to more populations in the state, including in achieving widespread coverage for children, is severely at risk if proposed cuts go into effect. So, what is currently being proposed? As you may have heard, Congress is considering a budget resolution that calls for cuts of at least $880 billion over the next decade for programs under the jurisdiction of the House Energy and Commerce Committee, and at least $230 billion for programs under the House Agriculture Committee. Two of the biggest entitlement programs under these committees are Medicaid and SNAP. And it has been incredibly clear that these two programs are the primary targets for budget cuts. To put Medicaid in context, there are 7 million New Yorkers on Medicaid, including nearly half of children aged 0 to 18. Medicaid covers essential care ranging from preventive services to hospital stays to childbirth to prescription drugs and so many more vital services for low-income New Yorkers, including children, pregnant people, and people with disabilities. So, what would the impact of these proposed cuts be on New York? If you want to jump to the next slide. To start with, the budget resolution does not specify exactly how these cuts would be achieved. However, we have a good idea of what kinds of approaches are being considered, and all of them would cause irreparable harm to the health of New York children and families. The bottom line is you can't cut the Medicaid program by $880 billion without severely and directly hurting millions of people. One proposal on the table is cutting the federal matching rate, which is the amount of money the federal government contributes to each state's Medicaid program. The Urban Institute estimates that if the federal government reduced its match rate for New York's expansion population, then 1.8 million people would become uninsured if New York responded by dropping their coverage expansion. A particularly popular proposal among Republican members is work requirements. However, it's important to understand that the vast majority of Medicaid recipients are already working, and those that aren't have clear and allowable reasons why they aren't. So rather than boosting employment, work requirements mean onerous income or paperwork requirements that create bureaucratic hurdles that have been shown to force eligible people out of the program and increase administrative costs. An estimated 48% of New York Medicaid beneficiaries would be subject to these onerous new work requirements. This will result in numerous eligible individuals, children, and families being disenrolled from services, and the savings from this proposal still don't come close to reaching $880 billion. There are a number of other proposals on the table intended to shift costs away from the federal government and onto the states. Ultimately, any cuts to the program could force states and localities to make cuts to eligibility, benefits, and rates, all of which have a devastating impact on coverage and access to care. So I'm now going to move in and talk briefly about SNAP. As with Medicaid, the specific policies the House and Senate Agriculture Committee would pursue to make these cuts are still unknown. But one thing is clear. Again, you cannot cut $230 billion or anything close to that amount from SNAP without slashing benefits, restricting eligibility, or some combination of the two. These cuts could directly reduce benefits for all SNAP enrollees from a program that already provides insufficient funding to meet the hunger needs of individuals in our state. Or they could take food assistance away entirely from some households, or lawmakers could shift costs to states. Again, that would have a similar effect by driving them to cut benefits, eligibility, or both. Ultimately, the 2.93 million New Yorkers who have SNAP are at risk of losing some or all of their benefits if proposals go through. So what can you do? We are urging you to take action. CCC has launched a new dashboard tool. This allows you to enter your address and see data on how many members of your community benefit from SNAP and Medicaid, as well as harms if federal funding cuts occur. You can see information on your Congress member and how they voted on the congressional resolution, and you can send a message directly to your representative with data about their district. We urge you to check out that tool, take action, and stay tuned as we continue to provide updates on potential impacts to New York and opportunities to act. And with that, I will hand it back over to Shabani, I believe. Or Rimsha, I'm sorry.
Thanks, Alice. I just want to remind everyone that if you have questions, you can put them in the Q&A or the chat, and we'll have time to answer questions at the end of the presentation. So going back to the data and the index report, we also looked at select data points related to housing to measure well-being. And I don't think anybody will be surprised to hear that high housing costs remain a consistent and persistent issue for many of us New Yorkers, similar to what we're seeing nationwide, really. One indicator that I measured was severe rent burden, which is defined as when a household has to pay more than 50% of their income on rent. In our analysis, one of the key findings regarding rent burden, which you'll see at the bottom of the slide, is that in 50 out of New York's 62 counties, more than 20% of renter households pay more than half of their income in rent, meaning they are considered severely rent burdened. So 50 counties shows that this issue is really widespread across the state. So the chart is showing the severe rent burden amongst a select group of counties, which were identified as having the greatest barriers to housing stability. And as you can see, these counties have renter households with who are severely rent burdened with a share between 23 to 32% of households dealing with a huge financial strain. And another indicator that I looked at as a part of housing instability was students in temporary housing. And these are students in public schools, including charters, who aren't in the shelter system, but are living in temporary arrangements, such as being doubled up with relatives or friends, staying at hotels or motels. The chart on the left shows the share of students who are in temporary housing by borough. In the Bronx, nearly 20% of students are in temporary housing, which is a staggering statistic. 20%, that's 1 in 5. And speaking of the Bronx, I do want to emphasize that these disparities are a result of longstanding structural inequities, and that includes disinvestment, segregation, and limited access to opportunities. These aren't flaws in individuals or communities. And we want to look at data critically and not stigmatize our communities when we highlight inequalities. And as a side note, I do want to note it is a fact that when we make investments, they pay off and improve well-being. In fact, our friends at CUNY Cares found that programming to reduce students' food insecurity, college students in the Bronx in the past 2 years, actually improved their food security when they put resources towards this issue. So I just wanted to note that as an example. But overall, these percentages, when it comes to students in temporary housing across the 5 boroughs and 5 counties, represents more than 100,000 New York City public school students. And in the past 7 or 8 years, the number of students in temporary housing in the city has consistently been over 100,000, which is far too many. And of course, outside of New York City, students in temporary housing is still an issue for other counties, including Oswego, Seneca, and Sullivan, where 4% or more of students were facing housing instability. And in these charts, I want to highlight the Bronx, Seneca, and Sullivan. And these are 3 of the counties that appear in that cluster of counties with the greatest barriers to housing well-being. And for the policy aspect, I will turn it over to Juan.
Thank you, Rimshar. Good afternoon, everyone. My name is Juan Diaz, and I'm a policy associate at Citizens Committee for Children. My portfolios are housing and economic security. I'll start with housing. For context, I'm going to start discussing the federal political landscape and how potential cuts to essential programs like public housing can have damaging impact to low-income families with children. Both the Republican-controlled Congress and the president have expressed intentions to cut significantly programs that have supported programs for housing, especially in New York. For instance, the federal government contributes close to 10% to Section 8 in NYCHA and 10% to New York City shelter costs. The federal branch has expressed intentions to cut HUD's workforce by 50% over the next 2 years. Now, we have heard from some of our shelter partners that they have already seen some cuts to their funding. So this is very concerning. Additionally, reducing Section 8 housing voucher assistance. Section 8 is a federally funded program that provides assistance to families in need, where families pay 30% of their income towards rent. Additionally, ending the emergency housing voucher program, which was initiated during the Biden administration and during the pandemic to provide support for families that were experiencing housing insecurity. This program is also at risk of cuts. To put also in perspective, in New York State, close to 1 million individuals receive public housing, like NYCHA, or Section 8 voucher assistance. So again, the threats of housing will be very devastating for families, especially for families with children. Next slide, please. As Rimsha mentioned, rent burden, students in temporary housing, housing court cases throughout the states calls for bold investments. Therefore, CCC and other partners have been advocating for the last the last few years for investments in New York State. So we have been advocating to fully fund what's called the Housing Access Voucher Program, HAVP, at $250 million. This program will be mirrored to Section 8. However, it will be more flexible as far as income threshold, and also it will provide assistance to far more populations. Also, investments, at least $900 million for NYCHA repairs. There's estimated 5,000 vacant units at NYCHA that need repairs, or they need enhancements to the apartments, and this would definitely help families that are experiencing housing insecurity, especially in shelter, and significantly enhance rental assistance to support thousands of households facing housing court eviction. Especially in the light of federal cuts, this will be hugely important. Now, as my colleagues have mentioned, the state budget is being finalized, but we have, the governor has announced that there will be $50 million allocated to launch the Housing Access Voucher Program. This is a promising start, but it's not where it's supposed to be, but it's a start for the first year. They're still closing details on implementation, on eligibility, so we'll be continuing to advocating on this. Also, There's consensus to provide significant funding for NYCHA. We're also happy about that. And $1 billion commitment for City of Yes. City of Yes is a city program that will spend the construction, development, and of affordable housing throughout New York City. So we're very happy for that. And now on the city side, with the city side, also there's a huge housing crisis, and CCC is a co-convener of the Family Homelessness Coalition, a coalition with over 20 social services providers, shelters, and people with lived experience. We have been advocating for reforms and funding that will help families maintain their apartment, leave the shelter system, and also move into affordable housing. Therefore, we have been advocating to fund the CityFEB's expansion. CityFEBs is a city, mostly a city-funded voucher program, housing voucher program. But it's not just the expansion. Also, we need assistance with rental assistance for CityFEBs. And this is something that we will continue to advocate. We have partnership with City Council that also has in their, as part of their priorities. Additionally, significantly enhancing support for home-based eviction and aftercare services. Home-based is a Human Resources Administration funded prevention and aftercare program. I actually happen to have worked there for several years, and I saw firsthand the needs that families have in low-income communities and how funding has remained flat, has remained the same for the last 8 years. Yet services needs continue to grow in low-income communities. Additionally, similarly like the state, we advocate for enhanced funding for NYCHA repairs, and also, similarly like the state, significantly enhanced rental assistance in light of federal cuts. These are all priorities that CCC and partners will continue to advocate. Although the mayor released, the executive budget proposal yesterday, we saw some investments, especially with funding for Wi-Fi access at shelters. This is a good, it's a good investment. Also funding for rental assistance at 1515 supportive housing program, which is a program that aims to develop affordable housing in the next 15 years for specific populations. We're happy to see that, but this is not enough. We need bold reforms, and we'll continue to do so in the next week, which calls for several City Council oversight hearings and rallies and testimonies and presses with partners. Thank you. I'll pass it over to Shivani.
Thank you, Juan. Hi all, I'm Shibani, a research and data fellow at CCC. I am going to be touching upon the counties encountering greatest barriers to well-being in education. So if we have the first slide. In the index, this report covers young children, high school students, and adult education levels. Here we have zoomed in on a key indicator for young children, early care and education, or ECE. ECE refers to programs that support early learning and development. In a place like New York City, nearly 120,000 children under 5 are enrolled in ECE programs. This data is from the census and is concentrated for 3- and 4-year-olds. ECE plays a critical role in supporting lifelong well-being. It helps build school readiness, social-emotional development, and narrows early opportunity gaps, especially for children in under-resourced communities. The chart here shows ECE enrollment rates in counties facing the greatest barriers to education. In 40 counties across New York State, fewer than half of 3- and 4-year-olds, or less than 50%, are enrolled in early education programs. This highlights a serious equity gap. You'll see in a majority of these counties that enrollment is much lower than 50% of 3- and 4-year-olds, with some exceptions. So if we move to the second slide for the education section, we will be turning our attention to older youth, looking at data on school completion across these counties, navigating the most structural challenges. High school graduation is a critical milestone linked to broader opportunity, educational pathways, and long-term well-being. And graduation reflects more than academic success. It often signals the presence or absence of stable supports like safe schools, community investment, and access to guidance. Where graduation rates are lower, it points to a need for deeper, sustained resource equity. And amongst the counties facing the greatest barriers to educational well-being, all except Hamilton County have graduation rates below the state average of 85.2%. This underscores the need for deeper, focused investment to support all youth in having a fair chance at completing high school. As Rimsha mentioned, these issues are very structurally rooted. So I'll now turn it over to Jenny to speak about how funding cuts to ECE can deepen these disparities. Thank you.
Thank you, Shabani. Hi, everyone. Thank you for attending today. My name is Jenny Velos, and I'm a policy associate here at CCC. And I'm going to start by discussing some key issues, as Shivani mentioned, impacting ECE at the federal, the state, and the city level. Excuse me. Beginning at the federal level, there are obviously numerous threats currently facing our education system, from funding cuts to attacks on diversity, equity, and inclusion initiatives. So during this presentation, I'm going to focus on one of the biggest threats to our ECE system, which is the proposed cuts to the Head Start program. As many of you possibly know, Head Start allows low-income parents to work, pursue their education, and to contribute to the economy, which plays a major role in New York State's affordability agenda. It also allows children to improve kindergarten readiness, enhance physical health outcomes, encourages healthier eating habits, reduces behavioral issues, and strengthens social emotional development. Now, if the program were to be eliminated, over 750,000 children nationwide would lose access to this form of early learning. Right now, so the Trump administration has already terminated staff at 5 regional Head Start Association offices, directly affecting over 374,000 children, including the Region 2 office, which supports Head Start and Early Head Start in New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. So what would this mean to New York State? So what this means that in New York State, cutting staff at that Region 2 office, 274 programs serving over 43,000 children and 900 pregnant women have been or will be impacted, while also impacting the employment of over 14,000 people annually. So next slide, please. Now I'm going to pivot and talk about some of the key issues that are impacting children on the state level. So CCC are members of the Empire State Coalition for Childcare, which is a statewide coalition of parents, childcare educators, and advocates who believe every family in New York State deserves high-quality universal childcare, and every childcare educator deserves to earn a thriving wage. As my colleagues mentioned, we are in the final stages of state budget negotiations and hopefully expecting a final budget sometime next week. And some of the issue areas where we have been advocating for on the state level includes increased compensation for childcare workers. There is a huge shortage of childcare workers throughout the state, and a major reason for that are wages and compensation. The majority of childcare workers, who are mostly women of color, earn on average about $35,000 per year, which is less than 96% of occupations in New York State. So there needs to be a mechanism to improve wages for childcare workers. And that mechanism could include providing a sustained and reliable compensation and benefits to all members of the childcare workforce. Another issue that we have been advocating for is increased funding to the Child Care Assistance Program, which is a childcare subsidy program that helps eligible families pay for childcare, and it serves more than 150,000 children throughout the state. Now, earlier this year, advocates were made aware of a funding shortfall for the CCAP program, which would impact access to childcare vouchers. Due to a combination of factors, low-income families would be directly affected, since fewer families will have access to vouchers if the state doesn't step in with adequate funding. So without additional funding, thousands of children throughout New York State will lose access to these vouchers, as counties across the state would be facing these funding shortfalls. So just as an example, April 1st of this year, 10 counties in upstate New York have already closed enrollment to newly or recertifying families. And in New York City, there 30 to 60,000 children would be forced on waiting lists by the end of the year. Now there is some good news. So about an hour ago, the governor did announce that she is expanding access to childcare by investing $2.2 billion statewide, which includes an additional $400 million investment to save these childcare subsidies or vouchers for families statewide, including an additional $350 million to help tens of thousands of families in New York State. So even though this does provide some form of relief for the program, it still falls short of the full need, but it is a good start. Now I'm going to pivot to the city and we can take a look at what's going on there. So we are also one of the leaders actually of the Campaign for Children, which is a coalition made up of providers, parents, and advocates fighting for universal access to early care and education and youth services in New York City. So just for a little bit of background, in January of this year, Mayor Adams released his FY26, fiscal year 26 preliminary budget that would have resulted in significant cuts to the early care or ECE program. Now, however, 2 weeks ago, he announced that he was restoring and baselining $167 million in funding for 3K and pre-K special education seats. So you'll see here in this slide, 112 million of that funding that was restored goes to 3K and 55 million restored and baseline for preschool special education seats. Now, we got some more good news because yesterday he released his executive budget, excuse me, which included essential restorations such as $25 million for that was restored and baseline for extended day programs, which gives working parents who need extended care to fit their work schedules additional flexibility for childcare. He also restored $5 million for ECE outreach, but only for this fiscal year. And ECE outreach will give parents just information that they need to access the program. And he also restored for only fiscal year 26, $25 million for Promise NYC, which is care for low-income families who are not eligible for other forms of childcare offered by the city. However, there were other programs and initiatives that were not included in yesterday's announcements that we continue to advocate for, which includes $70 million for special education, pre-K evaluations and services. Currently, over 7,000 preschoolers continue to wait for at least one of their legally mandated services, like speech therapy or counseling. So this $70 million in funding would help those children be able to access those services that they need. And also, you can see that Promise NYC is in both categories. So while we were happy that he restored the original $25 million for the program, we are also continuing to advocate for $60 million baseline for the program that would kind of reimagine and re-envision it to expand and include additional seats around 3,500 for infants and toddlers ages 0 to 2 without any eligibility requirements. So as we're going to continue to work on and to advocate and to fight for additional funding for these ECE programs and initiatives. And please stay tuned for updates on the city and the state budget, and also opportunities that you can take to advocate with us in the coming weeks. And now I will turn it back over to Rimsha.
Thanks so much, Jenny. And for our last category today, we'll be covering safe and economically secure, and I'm going to focus mainly on economic security data for this today. So jumping right into it, child poverty continues to remain an issue in New York State and city, In fact, over the past 2 years, the poverty rate has basically stayed the same for New York, almost 19% for the state, and I believe around 23% for the city. In the economic security domain, there were select counties that had the greatest barriers to economic well-being or higher than average barriers, which are listed out here on the chart. And these counties reflect their respective child poverty rates. And we can see that for most of these, more than 1 in 5 children, or more than 20% of children in Delaware County, Broome, Franklin County, for example, all fall under the federal poverty level. And in some cases, the poverty rate for children is higher, such as in the Bronx, nearly 35%. So the key takeaway from the state analysis is that in 20 of New York's counties, more than 20%, or 1 in 5 children, live in households below the federal poverty level. And of course, there's more to economic security than poverty rates. Many families in New York are struggling when it comes to income security as well as affordability, which is top of mind for many of us. I know definitely for me. The median income for families with children in New York State is $97,000. And you'll see that in the purple bar at the bottom. And compared to other counties where there was the greatest economic insecurity, those counties had median incomes, as you can see on the chart, that range well below that 97,000, between $63,000 to $75,000 a year. And of course, Bronx is definitely an outlier with a much lower median income. But again, I'll repeat, these inequities can be related to unfair systemic practices and policies. And what's interesting when we look at the income data is that living wage analysis shows something different, or analyses, I should say, because there's many of them. These analyses show that households with 2 working parents and 2 children would need approximately $138,000 per year to cover all of their basic expenses in New York. And this includes costs like transportation and childcare, which aren't typically covered in when we're looking at poverty rates. And for that, I used MIT's living wage calculator for that, which is also referenced in the report, but there are other tools that are available to look at the living wage, such as a tool that was produced by our partners at United Way, which we can share in the chat. And with that, I will turn it over to Juan for the policy piece.
Thank you, Rimsha. Yes, so poverty, there's several factors that impact poverty, but we at CCC will recognize that food supports, income supports, housing supports are important. Therefore, we have been advocating for significantly enhancing the state child tax credit, the Empire State Child Tax Credit, as I mentioned during the housing section, establishing a statewide housing voucher, HAVP, at $250 million, significantly enhancing the state public benefits grants. This public benefits grants are cash assistance, shelter allowance, which provides housing assistance for low-income communities, allowances for utilities. These grants have not been enhanced in over 10 years. And with the ongoing increase in living costs, this calls for enhancements. Additionally, enhancing food supports like universal school meals and SNAP minimum grants, especially with the high cost of living and how expensive food is. Similarly, though, Governor Hochul has recognized that child poverty and affordability, it's an issue that the state government must tackle. And we're happy to know, especially when it comes down to child tax credit, that it was tripled. So Governor Hochul announced that starting next year, every child in New York City that's eligible for the child tax credit under 4 will receive $1,000 credit. Children from the ages from 4 to 16 will receive $500. This is a really good investment because the current child tax credit is $330 per child. And also ending the minimum income phase, basically families that don't earn as much do not receive the full credit. Additionally, this morning, the governor announced, that universal school meals will be funded at $340 million to provide breakfast and lunches free statewide. Many areas outside New York City do not receive this funding, and it will save parents' households at $1,600 per child. This is huge, especially for parents on low-income communities, not just in the city, Long Island, upstate New York, and will provide much needed assistance so parents can use that money in other needs. We will continue to advocate both at the city and state level. We'll know more next week about more details about the programs. We didn't see investment in public benefits, but we're happy to see universal school meals and the state child tax credit priorities that CCC and partners throughout the state have been advocating for. And with that, I'll pass it over to Rimsha.
Sorry, I was on mute. Thanks, Juan. I'll just close us out. We will move into Q&A, but please stay tuned for CCC's full analysis of the state budget and the city executive budget, as well as ongoing opportunities to advocate for the policies and investments that families need to thrive. And I think Carlos will move us into the questions that were submitted.
Great. Thank you so much, Rimsha, and hello, everyone. I hope that was a really exciting and informative presentation by Rimsha and the rest of the CCC team, highlighting both critical information from the data perspective about what families are facing across New York State and what is being pushed by our organization and other organizations, and what the state really needs to do to make sure that we really provide the necessary resources and supports that address these critical, really foundational domains of healthy, housed, educated, and safe that families need, whether it ties to their experience with economic or housing insecurity, barriers to early care and education, or community resources that really need to be supported and in place to help children, young people, and families thrive. I'll let Rimsha leave the slide up for a few more seconds, just in case anyone needs to get the contact information. But I want to turn now to our team to have a discussion, answer some of your questions about that you've raised during the conversation, and give a chance for anyone else interested in asking Rimsha or any of our other speakers questions you might have on any of the indicators we raised or the policy ask we have been advancing as an organization in partnership with many groups like you. So when you have a chance, please submit your questions in the chat. I'll be taking a look to make sure that we have an opportunity to address everyone's questions. But while we wait for some more questions to come in, Rimsha, I think I have a question for you. I do see many of our partners here are familiar, but for anyone that's newer to CCC or to our work or this index, I want to ask you this. How can organizations or partners or even advocates use the index, use the data that you have provided here? And are there any other resources where partners can learn more about the data they are seeing or information about their community?
Definitely. So to start off, we will share back the slides from this event. So you should have those in a follow-up message sometime next week, as well as we've shared a link to the report And you can look up, depending on your position in terms of whether you're an advocate, whether you're working in a specific space or a specific area, there is data available by county. So you can pull relevant data, say you are in Buffalo and you want, so that would be Erie County, and you want to pull information for Erie County that is available in the tables. You can do a search for that and find it all laid out there. But of course, feel free to contact the data team email as well if you're having any issues with that or have any questions. One of the other tools that we shared in the chat was a living wage calculator tool. If you want to really delve into economic insecurity, I believe Julie's shared that in the chat. And there are other pieces that are cited in the report as well, including the MIT living wage calculator. So I think in terms of just data, those are the go-to tools I would go to. We also have our Keeping Track Online database, which has city level data. So if you're interested in looking at community districts or boroughs, we have more of that local level data with aspirations to one day also have state data on our site. But in the meantime, we do have excellent tools, other tools like the Medicaid lookup. And then I'll let the policy team speak more to the advocacy part, but data can be really powerful, whether you are meeting with elected officials or their offices, or doing a presentation or holding a convening of any kind. So, yeah.
Thank you. Yeah, in advocacy, especially with housing, it's important to change the narrative that housing insecurity, rent burden is a New York City issue. And when I've mentioned to state legislators or even partners that, rent burden, severe rent burden, in 50 out of the 62 New York State counties is prevalent. So when you mention that, a lot of people open their eyes. So, and it shows the importance to fund a housing voucher program, rental assistance. So it changes the narrative. Similar with income insecurity, investing in low income communities, not just in the Bronx, but also upstate, providing more supports for families with children, programs like guaranteed income pilots, things like that. It reflects, that is my point with this data, that poverty, housing insecurity, it's a New York State issue.
Right. Yes, thank you for sharing those resources. Again, I see our colleague Julie has put some of those materials in the chat. If anyone wants to access some of the resources mentioned or linked, and we'll definitely share those over email as well. But I want to move over now to questions from our audience. We have several in the Q&A, and I see some people have their hand raised. So if anyone would like to ask their question live, just raise your hand on Zoom like Lisa is doing. But I think our first question is coming from Clay, and this I think can go to you, Rimsha, and Shibani, if you want to add anything to it. Clay is asking, are there theories as to why Yates and Seneca counties have such high amounts of uninsured children? And I think Clay is mentioning some possibilities like a high Mennonite population, poor access to enrollment resources, or something else. Any insights into that?
Carlos, I'm actually happy to take this one first, and then if Rimsha have anything to add, happy to open that up. It's a great question, Clay, and I think it also draws attention to one of the purposes of the index, which is in some ways to be a starting point to draw attention to where these disparities are, to actually sort of encourage investigation into, where, if we are seeing, differences in different communities in the state, well, that can be a starting point to look into that further and see what can be done to address those disparities. But I will say for Seneca and Yates, I mean, those are Finger Lake region counties, and they are, typically included in sort of some of the areas that have a high primary care shortage. They're rural, there's a lot of space in between health facilities. So that could be a contributing factor is just that, with the more health resources you have available, the more connection points there are, the more ease of accessibility or continuity of care, and the more likelihood of actually getting enrolled in some kind of coverage, as well as other benefits that are available when you do connect to somebody who's familiar with and can offer those benefit points. So I think that's probably part of it, but I think it's a great sort of starting point to dig into further what else might be going on.
Great. Thank you so much, Alice. So our next question is asking, from the audience is asking, what is the age demographic of students in the STH measure? And I believe that's the students in temporary housing measure that was mentioned.
Great question. The age demographic is actually, it's broken down by grade level. So students in temporary housing is for students from pre-K through grade 12 or high school, as well as it's a small number, but people pursuing their GED are also included. So it's that demographic of people.
Great. Thank you, Rimsha. I'll now just go to, I think it's going to be a live question from Lisa Thompson. So Lisa, you should be able to unmute. Feel free to ask your question, and if you have a particular panelist you'd like to ask that of, feel free to say so as well. And all you need to do, Lisa, is unmute now. Okay. Lisa, if you can type your question in the chat, that might be more helpful because we can't hear you. I'll right now go on to the next question from Sarah, who's asking, what is your experience with the RAD programs or rental assistance demonstration? And Sarah's asking as a board member of a nonprofit located in a RAD building.
Yes, so thank you. So the rental assistance demonstration program is basically an initiative from the Obama administration to preserve public housing, to bring private investment, to retain public housing. I know personally a few developments in the Bronx where this project provides social services, amenities, supportive services, improvements, repairs, because there's private investment, some tax abatements. So I believe it's still early. Every organization has different experiences. However, a report from the City Controller's Office, I believe was last year, reported that in RAD developments, the housing court eviction proceedings were higher compared to other NYCHA units. Again, it was a bit concerning. Perhaps developers have more ability to, bring tenants to housing court cases, but we're still unsure. So that's one of concerns that we have, and based on our report from the New York City Controller's Office, that RAD developments have a high rate of housing court eviction petitions for their tenants. But overall, they provide more social services and repairs because there's private funding involved.
Great, thank you, Juan. Another question, I'm looking in the chat now for a moment. Nancy is asking about the automatic renewals for Medicaid, asking essentially why was it canceled, and is there any advocacy to reinstate that, and are there projections of what would happen if these federal cuts are enacted?
So I'm gonna address the sort of second part of your question on the projections of what would happen if draconian federal cuts are enacted. Yeah, so I'm gonna start with that piece. The projections, again, part of the challenge is we don't know exactly how the Congress will achieve these cuts if they do. What they've been given is a number, and they have to reach that somehow. And I think that there has been sort of a desire to convince certain members of Congress to convince themselves that these numbers can be achieved through fraud, waste, and abuse. there is not enough fraud, waste, and abuse in the world to reach $880 billion. And Medicaid is not a program that has fraud, waste, and abuse. And where it is, it's not the consumer who's abusing the system. It's usually some kind of provider or something like that that might be denying a consumer their benefit. So it's not the beneficiary who's at all committing any of this, right? So so it all depends on how whether they actually get to the 880 billion, because that's on the House side. The Senate side has a smaller number, and they have to reconcile these two. So it kind of depends on whether they do work requirements, whether they try to cut the cap, whether they try to put the onus on the states themselves. So it is hard to calculate the exact figure. What we did use in our tool is the Urban Institute estimate of 1.8 million, and that is for specifically if the matching rate for the federal matching rate was they took away their matching rate, and then the state was just decided, well, then we're not going to cover those that had the matching rate. And that's where that 1.8 million comes from. But there are lots of different ways you could calculate it based on what they ultimately do. The main point, though, is we just need to advocate as hard as possible to say any of these cuts are going to hurt people. There's no way to reach this figure without harming New Yorkers and without harming people from all over the country. And in particular, we need to focus on those really congressional Republican members. And we have 6 in New York State who are really sort of more at the budget negotiating table on these issues. And Nancy, I think on your automatic renewal, let me noodle around on that for a minute and I can get back to you. Maybe if we can move on to a different question.
I can chime in on the Medicaid renewal. So that was actually one of the emergency measures for COVID-19 that was implemented in 2020. And I believe either it was, I'm sure Alice could find details on that, either it was discontinued or rolled back recently. So yeah, it began as like a COVID-19 sort of emergency health measure. And with that, we saw increases because a barrier to enrollment was reduced for people. And now that barrier is back.
And so a lot of that piece is about educating, has been about educating about that this is how, a lot of the challenge has been there was not a long enough runway for understanding this was happening. And so it has resulted in a lot of folks knocked off of the program who are eligible.
Right. Thank you both. That was really helpful to know. And then I would again point to our audience here. Julie put in the chat the interactive tool where you could look up on how potential SNAP and Medicaid cuts would impact families within your own district. Please click on that link. You can enter your address to be able to complete one of our take actions and call on your representative to really step up and protect these important services for families. Lisa, I see you've unmuted. Do you have your question? Are you ready to ask? Okay. Yes, your mic is a little low, so if you could speak up, that would be great.
I actually don't have a question at the moment.
Okay, no problem. Thank you for letting us know. Okay, so the next question I have is from Patricia, and I think this might be for you, Jenny or Shabani, but Patricia's question is, can you please indicate who will be considered as not eligible for free childcare services? And I believe this is related to the Promise program that was mentioned in that segment.
Thanks for your question, Patricia. So currently the Promise NYC program is available to families regardless of their immigration status. Now, there's a movement supported by the City Council to, as I mentioned, to expand, reimagine, revision the Promise NYC program to focus more on infants and toddlers and remove that eligibility requirement. So that would be the first step. If we do that, then that will be the first step towards providing a universal childcare system that covers all families, not just a small subsection.
Great, thank you. Next, we're back to Clay, who's asking, in the report under the community section, one of the metrics measured was residents per large food retail locations. Maybe, is there any insights that you can provide as why that metric was chosen as an important indicator for community health? And I think that could be for Rimsha. Yeah.
Sure. I believe that was added in our last edition of the state index, the one that was released in 2023, in an effort, as you've noticed, like a lot of the indicators are deficit based. So we also wanted to look at resources that communities have. And that was one of the sort of like measures that fit our criteria where there is publicly available data by county. And so there's all these criteria when we try to include an indicator in our analysis. So sometimes that can shorten the list of what we can include. And I will also say I also included it in this last edition as well. Again, speaking to like the continuity of measuring trends over time. So that's an addition to the report, but we do want to keep it somewhat consistent going forward, if that makes sense, to look at what changes there are.
Great. Thank you, Rimsha. I see we have just a few more questions left. So if anyone else hasn't had their question answered, or if you have a question, please type it in the chat now. But our next question is from Caroline, who, and I think this goes to you as well, Rimsha. Is the Wellbeing Index shared today stratified by community district, or will this be available in the future? And if the answer is no, where can Caroline find community district level data on some of these indicators that you shared?
Great. So great question. We actually do have community district level data for New York City specifically, and it is a part of the CCC data website, Keeping Track Online. We have a section right now, which is called risk ranking. Although we're moving away from that terminology, it will be renamed to barriers. That is updated, I believe. We're in the midst of reworking our release schedule for when it comes to the city index, but I believe there should be one coming up next year, which will have more up-to-date data, probably 2023 data at the community district level. So stay tuned for that. And as far as New York State, I'm not aware of that. We haven't done that analysis.
Thank you. Another question, do we know the revenue each greatest barrier areas generates? I'm not sure if our panelists, if that question is clear enough, but whoever submitted that question, can you just explain a little bit more by what you mean by revenue each generates? Are you talking about like the cost of those programs or revenue generated in the communities? So whoever just put that question in the Q&A, if you could either type in any clarification you could give us, or if you want to raise your hand to ask that live, I can let you do that. And I'll just give them a moment to do that if they're typing. In the meantime, I do have another question for our policy folks. And this goes back to, I think, a lot of the themes that we were seeing in our policy sections is the implications of cuts happening at the federal level. So Alice, and for the rest of our policy team, can you tell our audience, what does New York State have the power to do to help New York youth, children, and families? And maybe related to this question, where do you hope our state can be the most impactful for any of the themes or issues that you raised in today's presentation? And any one of you can begin.
I'm happy to kick us off. I mean, I think we have to look at advocacy at every level, whether we're talking local, state, or federal. I think if we start at the federal level, as I mentioned, I think especially if you happen to be in a congressional district of one of the 6 Republican House members, it's a really great opportunity to talk to them about kind of what you're seeing in your communities and the direct impact of any of these proposed cuts. That's really urgently needed. And there's so many fantastic national and state partners who are working on these issues. So you can always reach out to us if you're hoping to connect with any of those groups, but really sort of joining forces on that kind of advocacy. But there's plenty of work to be done at the city and the state level to both sort of shore up any concerns we have around cuts, as well as try to be proactive and think about the kinds of investments. Because to the previous question about, I'm not sure if the question about revenue was more about kind of the long-term costs of these barriers are existing as opposed to addressing them. But everything we talk about is about prevention. When you invest in children, when you invest in family, whether it's healthcare, whether it's early childhood education, whether it's housing and homelessness, that leads to long-term positive outcomes for children, for families. And so, really what we should continue to do is work with our city and our state leaders to uplift the kinds of investments and policies that are needed to support children and families throughout the state. So I think, while it can feel very overwhelming what's happening at the federal level, and we should continue to focus on that, a lot of our power is here locally, is your communities and talking to your representatives and working with existing groups to really shine a light on what a multiplier effect it has when we can invest now, when we can support families and communities now. So I'd say just continue to advocate on these issues, stay in touch, and really, use your own experience or your own professional experience to focus on the urgency of supporting communities throughout New York. Jenny and Juan, I don't know if you guys have anything you want to add.
As far as I mentioned before, the cuts for in housing, right, 10% funding from the state and the impact that can have throughout the state. Again, funding the statewide housing voucher program, also rental assistance, changing the narrative, and as Alice mentioned, urging leaders to recognize that these are investments, especially with children and youth, and how this can provide upward mobility. Many times I saw working in home base how low-income families, their children wanted to go to college, but they had to make choices to start working right out of high school. And one case specifically that I always remember was that a mother working full-time finally was able to receive a City Fab's housing voucher, and her daughter was able to go to college. I saw her recently, her daughter graduated, has a bachelor's degree, a secure job, right? And that's what a housing voucher does, putting families and allowing, especially youth, going, and having careers and income ability.
And I'll just add and echo what Alice and Juan have said. Whether we're talking about housing, whether we're talking about SNAP and Medicaid, whether we're talking about early childhood education or just education in general, all of these issues are interrelated as investments for children. You invest in children early enough, that will help them so much as they continue to grow, to develop, and to thrive. So, and these investments and resources are especially critical and important right now. And opposing any proposed cuts are super important right now because it's pretty much a statement on the future of children and youth.
Mm. Yeah, thank you all. And Alice, you kind of helped me actually in your explanation clarify what this person was asking, and now it kind of clicked for me. So I think the person is also asking, in the slide that shows like all our counties with those facing the greatest barriers and least greatest barriers to the different indicators we have. I think the person is asking, is there a way to find out how much revenue each of those counties are getting, whether in total for these critical programs or services, or for at an individual these programs and services? And maybe a question I might add too is like, is the issues with some of the challenges that we're facing here that is shown in this index just a matter of revenue or more than just revenue that some of these programs are getting?
I'm not sure if I think I think that's a hard, I think it'd be hard probably if the question is sort of around revenue for different programs or things like that. The level of detail for the index is really more focused on kind of what are the measures of well-being, which is harder to tie directly necessarily to any particular program or anything like that. It's more about sort of the collective investment we see at the local and the state level to help sort of uplift and address these issues. So my mind is more at like that sort of idea of, well, we know when we invest in one area, we see outcomes. Not only if you invest in healthcare, we know we see outcomes in education. We know we see outcomes in, if you invest in housing, you see improvements in health, right? Like as Jenny said, these things are all interconnected. So while, you know, we don't necessarily have a dollar figure attached to like each, you know, indicator or indices or anything like that, we know from decades and bodies of research that all of these things, when you do invest in them, we see the returns not only to the individual child, but to their family, to their community, to the state, in terms of well-being. And so, you know, I think it's something we just keep saying, and we hope that it lands, because I think it's really at the core of what we're focusing on, is that we don't want to wait until young people are adults. We want to support families as early as possible.
Yeah, Alice, I would just echo what you said. There isn't sort of an economic analysis that looks at like the cumulative impact or the impact of these specific indicators altogether. Although I'm sure there might be a way to do this if we were to embark on a whole another big project. However, there are studies on a variety of these indicators that show that investments pay off in dividends in latter years. And I know internally we were recently discussing a study on early childhood programs showing that investment in early childhood resulted in I believe around a 13% increase in terms of life benefits. I'm forgetting the exact verbiage when it comes to outputs or a child's life later on as they grow up. And so there are sort of like one-offs by topic that could be referred back to.
Great. And with that, I don't see any more questions from our audience. So if there is a last question that we haven't been able to answer, now's the time to raise your hand or put it in the chat. In the meantime, I want to thank Rimsha, Shibani, Jenny, Juan, Alice, Raisa, and Julie for this incredible presentation and discussion that was put together. Again, you can access all of these resources by visiting our website to get this index or more information about all of our data, policy, and civic engagement work at cccnewyork.org. You can also learn more about our team. There's also a staff link that is going to be pasted in the chat. Again, we'll be linking the report to you in the chat and in the follow-up email. And lastly, if you want to hear more about presentations like this, opportunities, both from our research and data work, our advocacy work, and ways you can get involved and mobilize civically and engage around these issues, don't forget to sign up for our eAction network. That link is also being pasted in the chat. So again, thank you everyone for joining us here today on this incredible work put together by our team. There's a lot happening at both the state level and the city level as we transition to city budget advocacy. So stay tuned to news and updates, and we hope you continue to advocate with us over the course of this year as we really move forward and continue to become champions for our children, youth, and communities across New York City and state. Thank you again, everyone. Have a great rest of your Friday and a good weekend. Bye-bye.
Bye. Thank you.
Bye, everyone. Thank you.
Thanks all. Take care.